everybody. So good afternoon. My name is Agnes Adekai, and I'm with the Sonoran Center for Excellence in Disabilities here at the University of Arizona. And welcome to today's webinar. We have speakers from Arizona State University. They're going to talk about breaking down barriers to better care, improving research to improve our lives. And just before we start, I would just like to say that we have a few housekeeping rules to go over. Make sure that your microphones are off. And if you have any questions throughout the presentation, please put them in the chat. And today's session is being recorded, and all recordings and materials will be available in an email in the near future. Again, if you'd like to ask questions, please type in your questions into the chat box or use the raise hand function at the end of the presentation. And if you encounter any technical issues, please send a message in the chat to the Sonoran Center, who will address your question there. And so, as I said, the webinar is being recorded, and live captioning is available. And to access live captions, please click on the live transcript button at the bottom of your screen. So that's important if you need to access that services. And also, I would like to say that we are on the lands of the Tohono O'odham and Pasco Yaqui communities. We like to acknowledge that Arizona is home to 22 federally recognized tribes, and also that the university strives to build sustainable relationships with sovereign Native nations and indigenous communities through our educational offerings, partnerships, and community service. And so I will then pass it on to our speakers today to provide their introductions and their presentation. So welcome, ladies. The floor is yours.
Great, thank you so much.
Thank you.
Thank you.
Alrighty. So again, welcome everyone. We are from ASU Autism and Brain Aging Lab. And so we're just going to go over today speaking about neurodiversity. We'll also talk about kind of historical context about neurodiversity and brain aging and health, as well as just a little bit more what we do in our lab and how we can help. So again, a little bit of the table of things that we're going to be talking about today. Again, just more about just neurodiversity. Again, my name is Faith Johnson. I'm a neurodivergent researcher. I'm alumni to U of A. I know I work at ASU, but I'm alumni to U of A. My bachelor's is in neuroscience and cognitive science, and within the lab, I am a neurocognitive tester. And I do help out a lot too with also clinical reviews and other data-focused stuff.
Hi, everyone. I'm Kaitlyn Félix. I'm a research program manager, and clinically, I operate as a nurse as well in various settings. But as a research program manager at ASU, I work in program evaluation, mixed methods research, a lot of community engaged research projects, and just very excited to be here with all of you.
Then I'm Skyler. I'm actually a student currently at ASU. I'm getting my auditory and language neuroscience master's degree right now. I mainly work in this lab, but also do some of my thesis work in another that focuses on ADHD and dyslexia, and specifically those genetic and cognitive factors that might be affected with those who have comorbid ADHD and dyslexia. In our lab, mainly do cognitive testing, but also help with scheduling, screening, motor testing, and kind of where else I'm needed. Thank you, guys.
All right, so just diving into what does neurotypical versus neurodivergent mean? So neurotypical is someone who thinks and processes information in ways that are considered typical within their culture. This could be presented as reaching developmental milestones at a similar time to other children. So pediatricians' parents might be looking at like walking, crawling, talking, other skills like that. Adaptation to their environment and circumstances, situations that they're in, varied interests, hobbies that are typical for a person's age, or having social and organizational skills that are typical for their peers. Someone who is neurodivergent That's someone who thinks and processes information in ways that are considered not typical within their culture. Again, maybe reaching developmental milestones differently than neurotypical children. That could be maybe they exhibit that behavior differently or they reach that milestone at a later time. Sensory overload, fixating, or again, having social and organizational skills that are not considered typical in that culture. We want to emphasize that being neurodivergent is not a negative. It just means that that person has a different overview of the world and just processes things differently than what most would consider typical. And that can be seen through stimming or masking behaviors, which will be later discussed in a later slide.
Okay, so we're going to talk about briefly autism spectrum condition. Now, you may be wondering if people have previously seen as an autism spectrum disorder. In our lab, we like to call it ASC, which is autism spectrum condition, because it reflects a neurodiverse affirming perspective. Autism spectrum disorder is a medical term, but again, we just want to make it more affirming. What ASC is a neurodevelopmental difference that can be diagnosed at any age, but however, it's often diagnosed within 2 years of life. Children are just typically just diagnosed first, and it's just seen that way. As well as it can be categorized by restricted interests, repetitive behaviors, such as stimming, which that can look into being like flapping your hands, or sensory overload or noises, as well as social communication difficulties, so speech delays, impediments, and others. As well as autism, one of the things we'll go over later about some common misconceptions is that autism is something that just happens within childhood. It is actually lifelong. So people of all genders, ethnicities, ages, and economic backgrounds can be diagnosed. So going a little bit into the history of stigmas surrounding research, but specifically neurodiverse research, we have to unfortunately look at the historical mistreatment and the unethical research that has lasted within a distrust and marginalized communities. It has made it challenging for researchers to rebuild trust, particularly within the Black, Indigenous, Native American, and also other people of color communities across the nation. As a result of this has led to gaps in participation that have affected our understanding of diverse individual differences that can exist beyond the predominantly studied demographic, which is typically the white neurotypical males, and scientific research. To us, rebuilding trust means community-based participatory research, also being transparent about consent and data use, as well as having diverse research teams, which we strive in, as well as returning results and the benefits to the community accurately, and also acknowledging past harms openly. And just a little bit more of some important takeaways. Again, when we're looking at historical and systemic factors that for brain aging, this can include chronic stress and intergenerational trauma. I like to think of it as trauma can leave that residue on the brain. So symptoms including brain fog, for example, as well as the limited access to culturally responsive healthcare. Unfortunately, we still don't have enough representation of people of color in the healthcare and research field, specifically when we're looking at psychiatry and neuroscience. Also, when we look at higher rates of untreated health conditions, brain aging can be associated with other health conditions that are not looked into enough, but as we are advancing into research, it's looked at. So for example, when we think about the gut and brain hypotheses, looking at how does your gut health relate to your brain health? You are what you eat, as well as looking at similarities between diabetes and brain health and cardiovascular disease. So these are all advancing within research. So again, just a little bit more about what does this mean? Again, that lack of knowledge of the cultural and individual differences can be a barrier to equity in healthcare. Again, that lack of representation that's needed. Also in mental health care and supporting educational and workplace settings of policies, sort of what we're doing now. We also want to acknowledge too that it is not a one size fits all when it comes to speaking to different cultures and communities. Everyone has their unique genetic codes, social pressures, and cultural norms that are needed that we need to look into. And we just believe that lack of understanding, of that trust, of that empathy, and just really learning and listening to one another is what's holding research back from serving the people.
Okay, so now to get into some of the common misconceptions regarding neurodivergence is the first one being that neurodivergent individuals use their neurodivergence for their own personal benefit. This definitely comes from other neurotypical peers, and I would say even more in childhood than adulthood. Some of these examples would be like extra testing time, or for example, Disney actually offers fast passes immediately to individuals who are neurodivergent. So some people can say that people claim their neurodivergence for their own benefits, but that's definitely a common misconception. Another one is that neurodivergence means you are unintelligent, more so in the context of intellectual and developmental disabilities, or IDD. This is also a common misconception, such that neurodivergence just means that individuals or those with IDD and other neurodiverse backgrounds operate at different levels than their neurotypical peers, and that can affect learning, problem solving, communication, or daily living skills. Everyone's neurodivergence affects each individual differently, and it provides them with different capabilities. So yeah. Third, neurodivergence is just including autism. This is actually also a misconception. There are several other conditions that also fall into neurodivergence, including OCD, ADHD, dyslexia, bipolar disorder, dysgraphia, and a couple of others. Next, neurodiversity is an excuse for bad behavior, kind of similar to what Kaitlyn and Faith have mentioned for stemming and masking. Sometimes, especially in children, those could be seen as poor or bad behavior when in reality they're just trying to cope with how their brain functions differently than their neurotypical peers. So yeah. Neurodivergence also being curable is a misconception. You cannot outgrow your neurodivergence or cure it per se. However, you can gain skills and participate in other treatment plans to learn how to better cope or manage the way your brain works differently than others. And then lastly, women are less likely to be neurodivergent is also a misconception. Everyone has the risk to be neurodivergent, and oftentimes we actually see that males are more frequently diagnosed with neurodivergent conditions when compared to females. Okay, so now for a couple of key facts. One of them being that African American children and people of color are at higher risk for behavioral disorders, such as conduct disorders or behavioral problems. These oftentimes present as conditions like bipolar disorder. And it is also a misconception that women are at more risk for behavior disorders, kind of similar and piggybacking off of what I said on the previous slide. Research shows that women are diagnosed at less frequent rates due to higher functionality in masking. So we often see that women are oftentimes better than covering up their differences than men are, kind of leading to a higher diagnosis rate in males compared to females. Now to get into some important takeaways. So some individuals who are neurodivergent can experience brain aging differently, with some reports showing that some individuals have a higher risk to neurodegenerative conditions like Alzheimer's, dementia, or Parkinson's. And some more kind of piggybacking off of that, risk definitely does not equal absolute diagnosis. So even as far as memory or brain health goes, there is some people will have a higher risk than others, but that definitely does not mean you're absolutely going to get diagnosed with any condition leading more into your life. Similar to that, education does equal community awareness, kind of how we were talking. The more that we can communicate and kind of make people aware of neurodivergence and some of these behaviors that people kind of demonstrate to cope with how they're feeling and how their brain works, definitely will lead to more education and more community awareness for those individuals. And then lastly, early monitoring definitely equals improving prevention. The earlier that you can monitor your symptoms and kind of jump on top of that, the better you are setting yourself up for preventing and kind of overall just having the conditions throughout the rest of your life.
All right, doing kind of a deep dive of what does our lab do. So our research explores how aging affects adults with and without autism, aiming to identify differences across various factors, including memory decline and neurodegenerative risk. These insights help advance precision medicine and inform targeted interventions. We prioritize participatory research, so engaging community members to ensure our work directly supports those it aims to serve. Our team is committed to inclusivity, striving to build participant groups that truly represent the diversity of our communities. And as a multidisciplinary lab, we collaborate with Barrow Neurological Institute, the Southwest Autism Research and Resource Center, or SARC, as many of you probably know it referred to as, and several other researchers at ASU to drive these meaningful discoveries. And this is one of our recruitment flyers that we have. So as you can see, we have like our contact info up here, and we do offer $200 in Amazon gift cards for each visit. It is a longitudinal study, so the visits are repeated every 2 years to collect that data. And that, again, helps us better understand brain changes in adults with and without autism as they age. So just that whole continuum to see how that goes. Some of the things that the study includes is down here in this corner. So cognitive testing, it's very extensive. It's about 3 hours. We have a functional MRI for about 2 hours or so. It's a little different than a typical MRI where you're told to lay still, like maybe if you've had an injury, you've had an MRI before. In a functional MRI, you're doing tasks and you're kind of responding back and forth with the MRI technician. And again, it's mapping the brain, seeing what's being highlighted during those tasks. Several self-report questionnaires and surveys. We also have questionnaires for friends or family members to, again, give us that overall view of the participant. We also do some saliva and blood collections as well. And of course, all of it is voluntary. All of it is opt-in, opt-out for all of our participants. This is our general lab email, some of our social media accounts. So we're on Instagram, LinkedIn, Facebook, X, or Twitter. We post pretty regularly here and there, try to get engaged with our participants, but also highlight all the great work that our lab team does, whether it's publications, posters, conferences, or just highlighting some of the amazing studies that they're all participating in. But thank you so much for having us. We're ready to take any questions if you have any.
Thank you very much for the informative presentation on the ASU Arizona State University Brain Aging Lab. So my question is, what other research projects are you doing? Because you've mentioned that one particular one that you're currently doing. What other projects has your center completed or is in the process?
We have several PhD students who are within the lab looking at different things. So we have one PhD student working in Parkinson's research alongside ASD. What's another?
Genetics.
One of ours is working in genetics. You name it. I mean, there's so many. We have several from the undergrad, master's, and doctoral level who are working on projects.
Yeah, I can add a little
go
bit
ahead.
more too. I know there's a student in our lab too that's looking at menopause as well as into being neurodivergent. I know as well, Skyler, you're looking into ADHD and then dyslexia. So we have some up and coming ones as well as we continue to get our lab grows. So yeah, it's a lot of recurring projects.
Yeah, I know one was a meditation specific one as well. Yeah, ongoing projects for sure.
Great. And so another question I have before we start addressing questions that are going to come from the audience is, how did you get involved in this type of research opportunity? What sparked, what's your why of doing this type of work?
Well, yeah, I can start. My why is number one, I'm a neurodivergent researcher myself. I did not get diagnosed until I was an adult. Just for context, I'm 24. I did not get diagnosed until I was 20. Being from my culture, Black and Brown community, there was not a lot of representation, especially looking into research. Coming into this lab, Dr. Braden's amazing, as well as we have Kaitlyn and Hector and all of our amazing students and people in the lab that has came here and really strive on inclusivity and being able to advocate and speak to different cultures and communities, because this is important, right? And we don't, sometimes people only know about their diagnoses or going into places when it's just a hospital or a clinic. We want to make this very welcoming, very safe, and seeing all of us coming from different backgrounds and cultures is just what needed. So that's my why, to just give everybody a voice.
Good your way.
My why is definitely, I also am neurodivergent myself. I have OCD and ADHD, so also kind of gotten diagnosed later in my life. And I also want to go to med school following my master's degree. So honestly, any way that I can help provide personalized and better treatment options, even if that includes more accessibility, more speaking to others, just to include more about their education and the awareness of different people in our community and how everyone could feel included.
Yeah, and for me, I got into healthcare and then specifically the neuro world. My grandfather took care of me, and then unfortunately, our roles kind of reversed at a very young age, and I became his caregiver around 11 years old, and I took care of him until I was about 13, 14, and he unfortunately passed away. But his cancer had metastasized, and he developed dementia, and having to navigate healthcare and medicine, very complex systems, as we all know it is, was very difficult. I was not only, navigating that very young, but I was also the translator, a lot of cultural things going on. And I carried that through my entire healthcare experience as a CNA and then as a nurse, and now as working to become a provider myself. Very important to me that we do as much as we can for our patients, putting that person first mindset at the forefront. And I just became very obsessed with the brain and all the things that it does and how complex the puzzle of human anatomy is. And that's kind of how I've ended up my career at ASU. I work with this lab and several others, but have always kind of gotten my way back to Alzheimer's and Parkinson's and other neurodegenerative disorders. And that's kind of how I've gotten here to this lab with Dr. Braden and this team.
Well, thank you very much for sharing that. That's always really important to hear the why of people doing this work. And many times it's personal, and we have a vested interest in the work that we do and to make sure that our communities are well represented and receive the care that they deserve. So thank you very much for sharing that. So we'll start transitioning over to some of the questions. There are some questions in the chat. Particularly this one asked about the research project of how many participants are you aiming to recruit with the particular project you've posted?
It's open. Right now we are a little bit backlogged. We had our MRI down for maintenance, and so we're just getting back up and following up with our previous participants who were due last year and are coming up this year. But we're always looking for participants. It's always rolling enrollment. There's eligibility screeners, and we kind of just go through that process as they fill out. So I can put that link in the chat and share with you guys.
Okay. Another question we have is, hi, thank you for the information. Are you or other folks at ASU doing anything with kids with autism or parents?
Yeah, so I know when it comes to our lab, unfortunately, it's mostly just adults right now that we're looking into. I always say never, but at the moment we are just working with adults at the moment. But if there's a parent and you're an adult, we would love to have you, as well as just, yeah. So everything in our lab is just always something is changing. So yeah, you never know, but at the moment, just adults.
I worked
Okay, so
pediatrics for a long time, so I'm always rooting for peds.
I'm pretty sure there is one lab that is on campus that does work with autistic children, but honestly, I would have to get more information to relay it to you guys about that.
okay, thank you for that. And do you have a community advisory board of maybe parents or of community members who help oversee some of the work or provide guidance?
Yes, Dr. Braden knows much more on that than I do on this side, but there is a community advisory board that is consulted for this lab.
Okay. So another question we have is, I would like to recruit more tribal members from Navajo. Would they be able to participate virtually except on those days for in-person data collection?
Data collection.
We mainly work, honestly, whenever we collect data, it's mainly in person. Other than that, though, there's typically our process kind of looks like after you get screened, we schedule you and then we call you to go through our consent. And then at that time, you also get surveys. So that kind of portion of that can be done virtually. The only thing is that cognitive testing or if you choose to do saliva or blood collection or motor testing, and obviously the MRI will also be in person. Well, we do have options where you could split up your visit into 2 different days. If you want to do one more focused on your cognitive testing, if you want to then do another one more focused on your MRI. And we also have options where you could do it all on one day. So it would be like a 1-day commitment for 2 years. And we do help with transportation. And if you do happen to move out of state within your 2 years, we do help with travel compensation as well.
Yeah.
Do we have any other additional questions for the presenters? So they did put in the Gmail for the lab itself. Did you post in the chat the flyer for your research?
I did. I put in our contact me link, which will give you the eligibility screeners and things like that.
Okay.
Thank you, guys.
Thank you.
Thank you, everyone.
Thank you, everyone.
Okay, so I don't see any other questions. Any other questions from the audience before we end? Okay. Was there anything else that as speakers for today's webinar you wanted to address as well that we may have not had enough time to go over in your presentation?
I can't think of anything right now, but I see quite a bit of our lab team members here, so they're happy to. Yeah. I did see that one of our lab teammates, Hector, put in SARC is always working with kids and parents. They constantly have research going on and other resources they can offer. So if you're interested more in the pediatric or parental side, please check them out.
And can you explain what SARC is?
SARC is the Southwest Autism Resource and Research Center. They have several researchers working in their labs, but they also offer resources like the screening, testing. They can help navigate what other resources you may be needing, whether it's educational materials or just guidance throughout the process. They're a great, great, great resource.
Thank you very much for that. Anything else? So that'll be the end of our presentation at the introduction to the ASU lab and what they're doing and the current project that they have. If you have any questions or want to connect with them, they did put their Gmail in the chat and also a link to the flyer. So again, the presentation is recorded and will be posted on our website, a link to it, and it'll also be sent to folks. So I do kindly request that you fill out the evaluation to give us feedback on this webinar. We do collect evaluation and we look at it to see what other webinars, any topics of interest you like, and also it does get submitted to our funders. So to see the kind of work that we're doing. So thank you very much, ladies, for a very informative webinar. Faith, Kaitlyn, and Skyler, for sharing your why of why you do this research and the importance of the research you're doing at ASU. And have a good day, folks. Thank you very much for joining us.
Thank you.
Appreciate it, guys.
Bye.